Good evening, everybody. You probably heard me page to come up here. I have to confess I was trying to hang out in the back and get the chicken before I did. All I got was the salad. It was good. I have a big task, as we all do, 10 or 15 minutes to talk about what my institution, Holy Cross, is about, what's going to happen in healthcare across the United States, and what we're going to do about it. Pretty daunting task. Let me start by saying here's how we face that challenge at Holy Cross. We face it, we think, in a good position. I'm going to say at the end we face it not the least bit complacent, but we face it in a good position. We are a large institution in size. It's going to Manor. We are the largest hospital in the county, and we are the third largest hospital in the state. And we're proud of that because it means people choose us. We face it with a big focus on quality, and I am very proud to say that last week the Joint Commission selected Holy Cross, the only hospital in the state, as the top performer on their quality measures. Only 400 hospitals in the country got that designation. We do have the lowest rate of potentially preventable complications. It is true that the Rate Setting Commission now gives bonuses and penalties for that. That comes from a lot of hard work by our medical staff and by our nurses and others. We face the world strong financially. We've been a top financial performer, top 5 in the state for the last 7 years. And we face it with a strong medical staff today and a growing hospital. We've been a leading growing hospital over the last 5 years, and we're going to be building a new hospital and expanding our existing hospital. So I feel very good about all those things. I feel not the least bit complacent about what that means, because the forces we're talking about are significantly bigger than any of that. What is going to be the future? I don't have that answer, but I'll give you a couple of thoughts. I think there's 2 big things that are going to affect what happens: health reform and demographics. Health reform is really important and really uncertain. Demographics is really important and it's very certain. We're going to go through an aging process in this county that we have never seen before. Between now and 2030, we will double the number of people over 65. The growth rate for the rest of the population over 20 years is 6%. So if you think about seniors who use health care at a rate 6 times higher than the rest of the population, and they are going to be the only growing force in our area, you know they're going to affect health care. And in many ways, I really do think that's the challenge for hospitals, for physicians, for the whole healthcare system. We've tried to respond to that by focusing on seniors, by creating the first seniors emergency room in the United States, and trying to embrace the fact that that's going to be our world. I also think seniors are actually at the core of health reform. Why do I say that? I think seniors and the uninsured are going to drive everything else that we face as an industry, because we're trying to cover 30+ million people who are not covered today, and deal with the fact that we're going to have an explosion of seniors, and we're going to try to do it while staying solvent as a society. And I think what that means is that there's going to be a big response to it. The seniors are not going away. We are going to try to cover people who are left out. How do we do that and not go broke? And I think what you're going to see is aggregating care, and I think you're going to see shifting risk. Democrats and Republicans are both really into shifting risk. Democrats, if you read most of their proposal, including a lot of health reform, try to do that more toward providers in a pretty overt way. Bundling, trying to drive capitated payment, trying to lower reimbursement so that the squeeze is on the provider side of the community. Republicans, if you read the Ryan plan, basically want to shift the risk to the beneficiary, but it won't stay there. If you're only allowed X amount of dollars for your Medicare reimbursement, you're going to have to find somebody who can do it for that amount of money, and that's going to drive behavioral change that's significant. I don't think I'll stop and have a snack. act now. I clearly shamed them into this.